Let's start with a truth you might find shocking: the aching in your knees, the stiffness in your hips, the soreness in your fingers after 60 isn't just normal aging. It's often the culmination of a silent biological heist that began decades ago, where your body, bit by bit, has been slowly robbing your joints of their natural cushioning and lubrication without you even realizing it. You see, when we're young, we operate under the assumption that our joints are like perpetual motion machines designed to carry us through a lifetime of movement without complaint. We jump, we run, we climb, and we rarely, if ever, spare a thought for the intricate biological engineering that allows for such seamless motion. The reality, however, is far more complex and precarious. Inside every movable joint, your knees, hips, shoulders, and the small joints of your hands and spine, exists a masterpiece of natural design: articular cartilage. This cartilage is a slick, smooth, and remarkably resilient tissue that covers the end of your bones, preventing bone-on-bone contact and allowing for frictionless movement. Think of it as the body's perfect self-healing Teflon coating. Alongside this cartilage, we have synovial fluid, a thick, viscous liquid, often called joint oil, that fills the joint capsule. This fluid isn't just a lubricant, it's a nutrient-rich superfluid that nourishes the avascular cartilage, which lacks its own blood supply. The entire system is encapsulated by the synovial membrane, which carefully produces and filters this precious fluid. For the first 4 or 5 decades of life, this system maintains a delicate but robust balance between wear and repair. Specialized cells called chondrocytes within the cartilage work diligently to repair minor damage, and the synovial fluid's composition remains optimal. But here's the critical pivot point that mainstream conversations about aging often gloss over. This balance is not designed to last forever. The decline is not a sudden event at 60, it's a slow, insidious process. The most significant factor is the dramatic and often overlooked change in the very composition and volume of your synovial fluid. After a certain age, the production of key lubricating molecules, primarily one called hyaluronic acid, begins to diminish. Hyaluronic acid is what gives synovial fluid its uniquely thick, cushioning quality. As its concentration drops, the fluid becomes thinner, less viscous, and less effective. It's like replacing high-grade, weight-bearing motor oil in your car with a watery, diluted substitute. The lubrication fails, the friction increases, and the wear accelerates exponentially. Concurrently, the cartilage itself undergoes a transformation. The chondrocyte cells responsible for maintenance and repair become less active and fewer in number. Their ability to synthesize the crucial structural components of cartilage collagen for tensile strength and proteoglycans for shock absorption diminishes. The cartilage matrix, once a dense, hydrated, and springy structure, starts to lose its water content and becomes drier, more brittle, and thinner. Tiny fissures begin to appear on its once glass-like surface. These are not yet the deep craters of osteoarthritis, but they are the first cracks in the dam. Furthermore, the collagen fibers within the cartilage, which are arranged in a precise cross-linked architecture for maximum strength, start to undergo something called glycation. This is where sugar molecules bond haphazardly to the proteins, making the entire collagen network stiffer and more prone to damage. It's a process akin to the stiffening of a once flexible leather belt left out in the sun. So by the time you reach 60, you are not suddenly getting old. You are instead entering a phase where the cumulative deficits of 20 to 30 years of silence, decline thinner fluid, drier cartilage, stiffer fibers, finally cross a clinical threshold. The joint's margin for error is now paper thin, an activity that your joints would have absorbed without a whisper at 45, like gardening for an afternoon. Walking on uneven ground or even descending a flight of stairs now sends a clear, painful signal that the system is overloaded. The pain you feel is not the cartilage itself, which contains no nerve endings, but the inflammation of the surrounding synovial membrane, the stretching of the joint capsule, or the irritation of the underlying bone, now experiencing abnormal stress. This is the foundational biological why. It's a story of depletion and cumulative micro-trauma, a slow motion shift from a state of abundant repair to a state of precarious balance. Understanding this is the first and most crucial step because it moves the narrative away from passive acceptance of aches and pains and into the realm of actionable biology. It frames your joint health not as a countdown to inevitable decline, but as a system whose remaining function we must understand, respect, and strategically support with the right knowledge. Now that we understand the silent biological heist of joint fluid and cartilage, we must confront the second, equally powerful thief that escalates pain after 60, the catastrophic loss of muscle mass and strength, a condition known scientifically as sarcopenia. If the joint is the engine, then the muscles, tendons, and ligaments are the sophisticated suspension and stabilizer system that protects it. The shocking data reveals that after the age of 30, we naturally begin to lose about 3 to 5% of our muscle mass per decade. And this rate accelerates dramatically after 60. This isn't about looking less muscular, this is about the erosion of your body's primary shock absorption and joint stabilization system. Every step you take generates forces that travel up your leg. With strong, plentiful quadriceps and gluteal muscles, a significant portion of that impact is absorbed by the muscle tissue itself. Before it ever reaches your knee or hip joint, strong muscles act like dynamic cushions. However, as sarcopenia sets in, these muscles atrophy, they become smaller, weaker, and less reactive. The consequence is that with each step, a greater proportion of the load is transferred directly to the articular structures, the thinning cartilage, the underlubricated joint surfaces, and the surrounding ligaments. It's like removing the suspension from a car and driving directly on the axles. Every bump and pothole jars the entire frame. This mechanical overload is a direct pathway to worsening pain and accelerated joint degeneration. But the problem deepens beyond just shock absorption. Muscles are also the primary stabilizers of your joints. Your kneecap, for instance, is guided in its track almost entirely by the balance pull of your quadriceps. When the inner part of the quadriceps weakens, which it often does preferentially with age and disuse, the kneecap can be pulled slightly out of its ideal alignment, creating abnormal pressure points and grinding on cartilage that is already compromised. Similarly, weak hip abductors, the muscles on the side of your hip, fail to keep your pelvis level when you walk, leading to a slight drop with each step, a phenomenon called a Trendelenburg gait. This places immense and uneven stress on the knee and hip on the opposite side, often explaining why pain appears in a joint that seems to be behaving. Furthermore, the loss of fast twitch muscle fibers responsible for quick stabilizing contractions means your joints have less protection during unexpected movement. A slight misstep on a curb or a quick turn to answer the phone can now result in a disproportionate strain or a micro-injury that your body struggles to heal. Tendons and ligaments, the robust cords and straps that connect muscle to bone and bone to bone, also undergo age-related changes. They lose water content, become less elastic, and more prone to stiffening. This reduced elasticity means they are less able to store and release energy efficiently, again transferring more force to the joint. It also means your range of motion can subtly decrease, leading to compensatory movements that strain other areas. The data linking muscle strength to joint survival is overwhelming. Studies consistently show that individuals with greater quadriceps strength have a significantly lower risk of developing knee osteoarthritis and experience far less pain and disability if they already have it. The narrative here is critical. The joint pain you feel is not an isolated issue confined to the joint space. It is, in large part, a symptom of failing architectural support. Your body is a kinetic chain, and weakness in one link creates destructive forces in another. This is why two people of the same age with seemingly similar levels of cartilage where on an X-ray can have wildly different pain experiences. The one with stronger muscles, better neuromuscular control, and preserved flexibility will often have dramatically less pain and greater function because their musculoskeletal system is effectively offloading and protecting the vulnerable joint. The pain, therefore, is a signal not just of joint distress, but of systemic muscular deficiency. It's your body's urgent request for you to reinvest in its foundational support structure. This understanding is empowering because, unlike cartilage repair, which is complex, building muscle, strength and neuromuscular control is something we can directly and powerfully influence at any age. The right kind of resistance training is not just good for you, it is a direct, non-negotiable medical intervention for post-60 joint pain. It is the process of rebuilding the shock absorbers and reinstalling the stabilizer that your joints desperately rely upon to find a new pain-reduced equilibrium. Beyond the mechanics of cartilage and muscle, we arrive at the third and most insidious accelerator of joint pain. After 60, the chronic, low-grade, systemic inflammation now understood by science as inflammaging. This is not the acute, helpful inflammation you get from a sprained ankle, the hot, red, swollen response that aims to heal. Inflammaging is a silent, body-wide, smoldering fire that permeates your tissues 24/7. It is arguably the single most corrosive force driving the pain and destruction of joints as we age. For decades, the medical view of osteoarthritis was a purely wear and tear mechanical model, but the emerging data-driven paradigm reveals it as a whole joint disease, heavily fueled by inflammatory biochemistry. So what ignites this fire? The culprits are multifold but interconnected. First, as we age, our immune system undergoes a phenomenon called immunosenescence. It becomes dysregulated, less precise, and paradoxically, more prone to inflammatory overreaction. Specialized immune cells called macrophages and the inflammatory signaling molecules they produce. With names like cytokines, for example, TNF-alpha, IL-1 beta, IL-6 become hyperactive. These cytokines are not just floating in your bloodstream, they are actively produced within the joint itself. The synovial membrane, once a simple lining, can become infiltrated with inflammatory cells, turning it into a factory for these pain-producing and tissue-destructive chemicals. These cytokines don't just cause the sensation of pain by sensitizing nerve endings, they actively attack the joint structures. They inhibit the cartilage-producing chondrocytes, they stimulate enzymes called matrix metalloproteinases that literally digest cartilage collagen and proteolycans, and they degrade the quality of synovial fluid. In essence, your own immune system, in a state of confused, chronic alarm, begins to vandalize the very joint it should protect. Secondly, the age-related accumulation of senescent cells, often called zombie cells, adds fuel to this fire. These are cells that have stopped dividing but refuse to die. They linger in tissues, including cartilage and fat, and secrete their own potent cocktail of inflammatory cytokines and tissue-degrading enzymes in what's called the senescence-associated secretory phenotype, SASP. This ASP creates a toxic local environment that accelerates joint tissue breakdown and irritates pain-sensitive structures. Thirdly, and crucially, our modern lifestyle provides endless kindling for this inflammatory blaze. The standard diet high in processed sugars, refined carbohydrates, and industrial seed oils like soybean and corn oil is profoundly pro-inflammatory. These foods spike blood sugar and increase the production of advanced glycation end products, agents, which we mentioned stiffen collagen, but they also directly activate inflammatory pathways. Excess body fat particularly visceral fat around the abdomen, is not inert storage, it is an active endocrine organ that pumps out inflammatory cytokines like IL-6 directly into your circulation. This means carrying extra weight after 60 isn't just a mechanical load on knees, though it is that too. It's like wearing a jacket lined with tiny, continuous release inflammation pods. Furthermore, chronic stress, poor sleep, and a lack of restorative movement all elevate cortisol and other stress hormones, which, over time, can dysregulate immune function and exacerbate inflammatory responses. The result of this perfect storm immunosenescence, senescent cells, and lifestyle fuel is a joint environment that is chemically hostile. The pain you feel is not merely from friction, it is from a biochemical bath of irritants. The stiffness in the morning isn't just from thickened fluid, it's from inflammatory mediators that have pooled in the joint overnight. This changes the entire game plan. Managing joint pain after 60, therefore, must involve strategies to cool the fire systemically. It shifts the focus from merely taking a painkiller that masks a symptom and often has severe long-term consequences for gut and kidney health to adopting an anti-inflammatory lifestyle that addresses the root biochemical driver. This means the food on your plate becomes a central part of your joint pain protocol. It means managing stress and prioritizing sleep are not luxuries but non-negotiable therapies. It redefines the battle from one fought only in the gym and the doctor office to one fought in the kitchen, the grocery store, and the mind. When you understand Inflammaging, you realize that every anti-inflammatory choice you make is a direct strike against the biochemical source of your pain and a critical step in preserving the very structure you are working so hard to strengthen and protect through exercise. Having mapped the landscape of biological decline, muscular erosion, and inflammatory fires, we now turn to the fourth critical pillar, the neurological and perceptual rewiring of your pain system itself. This is a frontier in pain science that offers profound hope, because it explains why the level of pain you experience can often seem disconnected from the amount of damage seen on an X-ray. After 60, it's not just your joints changing, your entire nervous system becomes a more sensitive and amplified pain alarm. This phenomenon is called central sensitization. To understand it, imagine your nervous system as a sophisticated security network with sensors, nerves in your joint. Wires, nerves, running to a central alarm panel, your spinal cord, and a main monitoring station, your brain. In a healthy, young system, the alarm only sounds when there's a significant threat of major injury. With age, and particularly with long-term conditions like osteoarthritis, this entire system can become hypervigilant. The sensors in your joint, peripheral nociceptors, become more sensitive, firing off pain signals in response to stimuli that shouldn't be painful, like normal pressure or movement, a state called peripheral sensitization. More critically, the alarm panel in your spinal cord undergoes a process called wind-up. Repeated pain signals cause nerve cells there to become more excitable. They start to amplify the signals, turning up the volume on the pain message before it even reaches your brain. Eventually, these spinal cord neurons can start firing pain signals on their own, even without a new signal from the joint. This is central sensitization in action. Your central nervous system has learned pain and is now producing it autonomously. Your brain, the monitoring station, also changes. The areas responsible for processing the emotional and cognitive aspects of pain, like the amygdala, fear center, and the prefrontal cortex, planning and evaluation, become more active. This means the pain is no longer just a physical sensation, it becomes intertwined with anxiety about the future. Will I ever be able to travel again? Fear of movement, kinesiophobia, frustration, and even depression. The brain begins to interpret safe movements as dangerous, creating a powerful pain-fear loop. You hesitate to move. The fear amplifies the sensation, and the amplified pain confirms the fear, leading to further avoidance and deconditioning. This cycle is devastating. Furthermore, the brain's natural pain-killing system, which relies on endogenous opioids and other neurotransmitters, can become less efficient with age, meaning your body's innate ability to dampen pain signals is diminished. The result is that a small, localized issue in a joint can create a widespread experience of pain, hypersensitivity, and disability that seems disproportionate. You might feel pain in areas adjacent to the joint, experience heightened sensitivity to touch, or have pain that lingers long after provoking activity has stopped. This neurological rewiring is why two people with virtually identical MRI scans can have radically different pain experiences. One whose nervous system has remained relatively calm may have minimal discomfort. Other, whose system has become sensitized, may be disabled by pain. The crucial, hopeful insight here is that central sensitization is a functional, plastic problem, not a permanent structural one. Because the nervous system is plastic, it can be retrained. This is the foundation of modern pain management approaches like pain neuroscience, education, graded exposure therapy, and cognitive behavioral techniques for pain. The goal shifts from trying to eliminate every last twinge, which may not be possible if there is some structural change, to teaching your nervous system that movement is safe, that the joint is not under catastrophic threat, and to dial down the amplified alarm signal. Techniques like mindful meditation, paced breathing, and gentle, non-threatening movement practice, like Tai Chi, have been shown in clinical studies to reduce pain perception, not just by relaxing the mind, but by literally downregulating the activity in the brain's pain processing centers and improving the function of the descending pain inhibitory pathways. Understanding this component liberates you. It means that a significant portion of your pain may be coming from a learned, amplified neural pathway, not from ongoing joint destruction. It empowers you to add neurological retraining tools to your arsenal. Alongside strengthening your muscles and cooling inflammation, you can begin to actively calm your nervous system. This involves paced, graded movement that builds confidence, breath work, that engages the parasympathetic rest and digest system, and cognitive reframing to break the pain-fear cycle. It turns the management of joint pain after 60 into a holistic mind-body endeavor, where calming the mind directly and measurably quiets the pain signals originating from the joint. So where does this integrated understanding of depleted joints, weaken, support, inflammatory fires, and a sensitized nervous system leave us? It leaves us not with a prognosis of inevitable decline, but with a powerful, multidimensional blueprint for action. The final critical piece of this puzzle is not another problem, but the synthesis of solutions, the concept of strategic, intelligent, and consistent loading. This is the active daily practice of applying the right kind of stress to your body to force adaptation in precisely the areas we've discussed. It is the antidote to passive suffering. Let's be unequivocally clear. The worst thing you can do for a painful joint after 60 is to cease loading it altogether. Immobility leads to accelerated cartilage degradation, which thrives on rhythmic compression and decompression for nutrient exchange. Faster muscle atrophy, increased systemic inflammation, and a reinforcement of the pain-fear cycle in your nervous system. The goal, therefore, is not rest, but smart restoration through movement. Your action plan must be layered, addressing each of the 4 thieves we've identified. First, to combat sarcopenia and rebuild the joint's shock-absorbing architecture, you must engage in progressive resistance training. This does not mean lifting massive weights. It means using bands, body weight, or light dumbbells to perform controlled compound movement that target the major muscle groups, stabilizing your hips, knees, and spine. The focus is on quality of movement, full range of motion, and gradual progression. A study in the Journal of Gerontology showed that even nonagenarians, people in their 90s, can build significant muscle mass with resistance training. Exercises like seated leg presses, controlled mini squats, heel raises, and clamshells for hip strength are foundational. The signal you send your body with this training is powerful. Do not atrophy. Rebuild. Second, to nourish the joint environment and combat inflammaging, your movement must include low impact. Rhythmic cardio that stimulates synovial fluid production and circulation without excessive jarring. Swimming, aqua aerobics, cycling on a stationary bike, and brisk walking on even surfaces are exemplary. Think of this as greasing the joint. The motion pumps nutrient-rich fluid through the cartilage, washes out inflammatory mediators, and improve overall cardiovascular health, which is intrinsically linked to reducing systemic inflammation. This should be done consistently, aiming for frequency over intensity. Third, you must directly address the stiffness in tendons, ligaments, and the joint capsule itself with deliberate, mindful flexibility and mobility work. This is not about forcing yourself into yoga poses, but about gently moving your joints through their full available range daily. Ankle circles, knee bends while seated, gentle hip rotations, and wrist flexion extension help maintain the health of the connective tissues and prevent contractures. This work tells your nervous system that movement is safe and helps maintain the functional space within the joint. Fourth, you must integrate practices that directly calm your sensitized nervous system. This is where mindful movement practices like Tai Chi or Qigong become extraordinary tools. They combine gentle strength, balance, flexibility, and a meditative focus that has been proven to reduce pain perception and improve function in osteoarthritis. Even 5 minutes of deep, diaphragmatic breathing each day can lower stress hormones and begin to retrain your pain response. Alongside movement, your nutritional strategy must be explicitly anti-inflammatory. Prioritize omega-3 fatty acids from fatty fish or algae, a rainbow of antioxidant-rich vegetables, and berries, high-quality proteins for muscle repair, and spices like turmeric and ginger. Simultaneously, drastically reduce the pro-inflammatory fuels, processed sugars, refined grains, and industrial seed oils. Hydration is also non-negotiable. Every tissue we've discussed, from cartilage to spinal discs, requires ample water to maintain structure and function. Lastly, you must master the art of pacing and recovery. The no pain, no gain model is catastrophic for an aging joint. Your new mantra is stimulate, don't aggravate. You should aim to finish an activity feeling like you could do a little more, not exhausted and in flare-up. Respect rest days, prioritize sleep as a time for tissue repair and inflammatory clearance, and listen to the nuanced difference between the good hurt of muscular effort and the bad hurt of joint distress. This integrated daily practice is your new medicine. It is more powerful than any single pill because it addresses every facet of the problem. It strengthens the support, lubricates and nourishes the joint, cools the inflammation, and quiets the nervous system alarm. It transforms you from a passive patient into the active architect of your own mobility and comfort. This journey from understanding to action is why you're here. This isn't just information. It's an invitation to change the trajectory of your life after 60. You now hold the blueprint. The science is clear, the pathways are mapped. But knowledge without action is merely trivia. Your body is waiting for the signal to adapt, to heal, to become more resilient. Start today, not with everything at once, but with one single, deliberate step. Maybe that's swapping your afternoon snack for a handful of berries and nuts. Maybe it's performing 3 sets of seated leg extensions while watching the evening news. Maybe it's committing to a 10-minute walk tomorrow morning. Choose one layer of this solution: strength, nourishment, mobility, or mindfulness, and begin. Your joints, your muscles, your nervous system are listening. They are plastic, they are responsive, and they are yearning for the right guidance. You have the power to cool the fires, rebuild the foundations, retrain the alarms, and reclaim your movement and your comfort. The next chapter is not written by your age. It's written by your daily choices. Start writing it now. And if this deep dive has provided you with value, with a new lens through which to see your health, then do me a profound favor. Share this video with one person who needs to hear this message. A friend, a family member, anyone struggling with the same frustration. Let's build a community dedicated to intelligent, empowered aging. Hit the like button. So I know this content is helping you subscribe to this channel, because every week we dive deep into topics like this, turning complex science into actionable steps for your life. And most important, leave a comment below telling me which of the 4 thieves, the fluid depletion, the muscle loss, the inflammation, or the nervous system rewiring resonated most with you, or what your first step will be. Your journey inspires me, and it inspires others watching. Now go take that step. I'll see you in the next video.